Hello there. We're going to spend a little time together today talking about something that can feel, well, pretty confusing, and for a lot of people, very personal. It's polycystic ovarian syndrome, or PCOS. I know that medical terms can sound a little intimidating, but my hope is that we can just bring a little bit of calm and a lot of clarity to this topic. If you've ever tried to look up information about PCOS, you know it can feel like you're trying to drink from a fire hose. There's just so much noise, and a lot of it doesn't even agree. If you felt lost or overwhelmed by it all, please know that is completely normal. So many people feel that exact same way. You are definitely not alone. So let's just quiet the noise and walk through this together.
Okay, first things first, let's clear up one of the biggest points of confusion right away. You've probably heard two acronyms floating around, PCOS and PCOD. And it's easy to wonder, are these two different things? The simple truth is, no, they're exactly the same condition. PCOD is just an older, outdated name. So if you hear them used, just know we're talking about the same thing.
Now, let's talk about the name itself, because I know the word polycystic can sound pretty scary. It makes you picture ovaries covered in cysts, and that's an alarming thought. But here's what's really important to understand. What doctors are seeing aren't actually cysts in the way we usually think of them. They're just very small, harmless follicles. Tiny sacs where eggs start to grow, but they just haven't been able to fully mature. The name is honestly a bit misleading. This next one is so important for you to hear. You will likely see things online, products, diets, programs, that promise to cure PCOS. Please be so careful with claims like that. The medical reality is that PCOS doesn't have a cure. But, and this is the part I really want you to take in, it is a highly manageable condition. The goal isn't a cure. The goal is management so you can live a full and vibrant life by learning how to support your body. So, to really understand what's happening with PCOS, it helps to first look at what a typical monthly cycle looks like. And to make it really simple, let's use a little story. I want you to imagine that your ovary is a quiet, well-behaved classroom where everything runs exactly as it should. So in this little school, your eggs, which are tucked inside those tiny follicles we talked about, are the students. Every month, a new group of students starts class, and the whole point of the school year is for one of them to become the star student and graduate. So how does the school pick its star student? Well, a special hormone messenger called FSH arrives. You can think of FSH as the teacher. The teacher's job is to give all the egg students the education they need to grow. It helps one of them get bigger and stronger than all the rest, getting it ready for the final exam. Then, when that one star student is fully prepared and ready to go, another hormone called LH sends a big signal. This is like the graduation applause. It's a huge cheer that tells that one special egg it's time to graduate. And that moment of graduation from the ovary, that's what we call ovulation. And what happens after graduation day? Well, if that graduated egg doesn't become a pregnancy, the body knows it's time to clean up and get ready for the next school year. And that process of cleaning out the old classroom to make way for the new one, that's your period. It's just the body's natural reset. So that's the story when everything is running on schedule. It's a beautiful, predictable system. But with PCOS, that classroom is, well, it's a little different. It's like the hormones have gone off script and things get a bit more disruptive. Let's go back to our little school. But this time, I want you to imagine that a few unruly students have walked into the classroom. You know the type. They're loud, they don't follow the rules, and they make it really hard for anyone else to concentrate and learn. These disruptive students have a name. They're a group of hormones called androgens. Now, it's totally normal for women to have some androgens, but with PCOS, there are just a few too many of them in the classroom. They create so much noise and chaos that it's impossible for any single egg to get the attention it needs to grow up and become that star student. And at the same time, something else can happen. Let's say our teacher is the hormone insulin. The teacher's job is to keep order. But in many cases of PCOS, the body's cells don't listen very well to the teacher. This is called insulin resistance. So what does the body do? It makes the teacher yell louder, sending out more and more insulin. But all that yelling just adds to the chaos in the classroom and can actually encourage those disruptive androgens to act out even more. So what happens when you have a classroom that's this chaotic, with all the noise from the androgens, and a teacher who can't seem to get control? Well, none of the egg students can ever finish their studies. No one gets to graduate. And that right there is the very heart of why with PCOS, ovulation and your period don't happen on a regular schedule. Okay,
So now that we have a picture of the story happening on the inside, let's connect that to the signals your body might be sending you on the outside, because that internal story shows up in ways you can see and feel.
You might even be nodding along, recognizing some of these. Because there's no regular graduation, your periods can become unpredictable or even go away for a while. Those disruptive androgen hormones can show up as things like acne that just won't quit, or hair in places you don't want it, like your face or chest. That teacher who's yelling louder, the insulin, that can make managing your weight feel like a constant uphill battle. And of course, if an egg isn't graduating regularly, that can make it more challenging to become pregnant. I know that seeing a list of symptoms like that can feel heavy. And if you're seeing yourself in some of these signs, it's so natural to wonder, so how does the doctor know for sure if this is what's going on? It's a really careful process, and I want you to understand how it works so you feel more empowered. The most important thing to know is that there's no single blood test or scan that just says yes or no. Instead, doctors use a specific set of guidelines. You can think of it as a simple 2 out of 3 rule. To get a diagnosis, you need to meet at least 2 of 3 key criteria. So what are those 3 things? First, are your periods irregular or absent? That's checkbox number 1. Second, are there signs of those higher androgens, those disruptive students, either physically or confirmed through a blood test? That's checkbox number 2. And third, does an ultrasound show a number of those little ungraduated follicles on the ovaries? That's checkbox number 3. You only need to check 2 of those 3 boxes. That's why having polycystic-looking ovaries on an ultrasound, all by itself, doesn't mean you have PCOS. Getting a diagnosis can feel like a really big, heavy moment, but I'd love to invite you to see it a little differently. A diagnosis isn't an endpoint. It's actually a starting line. It's the first powerful step on the path to understanding your body and feeling better. And please, hold on to this message. While it's true that there isn't a cure for PCOS, there is absolutely control. This is not something that just happens to you without you having any say. You are in the driver's seat of your own health, and you have so much power to steer your journey in a positive direction. So what does being in the driver's seat look like? Well, everyone's journey is unique, but the path often includes a few key things. It really starts with lifestyle, things like nutrition and finding joyful movement. Your doctor might also talk to you about medications that could help, like birth control to help regulate your cycle, or medicines to help with that insulin resistance we talked about, to help the teacher in the classroom. The most important piece is working together with a healthcare team that listens to you. And if you're finding this kind of calm, clear health information helpful, you might want to consider subscribing, just so you can stay informed and feel supported on your health journey. Your path forward doesn't have to be about making huge, overwhelming changes all at once. It's truly about small, consistent steps, one foot in front of the other. So as we finish up, I want to leave you with one gentle question to think about. What is one small, kind step you can take for your health today? Whatever you choose, just know that it matters. You matter. Take good care.